Namaste everyone. Today we're going to talk about heartbeats and pacemakers. Our heartbeat commences at the age of 9 to 10th week of intrauterine life and persists lifelong, giving us the most tangible proof of life. Beatings of the heart is an emotion to us and is probably the most commonly used emotion in literature. Origin of the heartbeats takes place from a small region of the heart situated on the walls of the right atrium. This region has a group of modified cardiomyocytes and is collectively called SA node. It sends electrical impulses to contract the chambers of the heart and produces heartbeat. If dysfunctioning of SA node is present, it causes a spectrum of disease resulting from derangement in automaticity, conduction, or both in SA node and is collectively called SA node dysfunction. But how will we survive if the SA node dysfunction is present? For this concern, a system was developed by surgeon X. Senning and physician inventor Rune Elmqvist and implanted it on a 43-year-old patient on 8 October 1958 in Sweden. Such system is referred to as artificial pacemaker in today's world. The evolution of pacemakers started in 1950s with an AC-powered pacemaker tethered to an extension cord. However, in 1958, first fully implantable pacemakers were developed. In 2016, leadless pacemakers, where the entire device is placed within the cardiac chambers, were developed. It is speculated that in the future, batteryless devices will be developed, which will harvest cardiac motion to power pacing circuits. The pacemaker is a small device that includes a pulse generator that runs on lithium-ion battery, wires called leads that connect the pulse generator to your heart. The pacemaker can be single-chambered having one lead, dual-chambered having two leads, or biventricular having three leads. Most commonly programmed modes of implanted single and dual-chambered pacemakers are double VIR and triple DR respectively. Did you know that 1 to 2 million people worldwide use pacemakers to regulate their heartbeats? And did you know that among them 6% people are under 49 years of age? So it is completely wrong to think that only elderly require pacemakers. But how does a pacemaker work? The wires or leads are inserted into veins and electrodes are implanted into one or more chambers of the heart through the leads via the veins. The pulse generator is implanted under the skin in the chest or abdomen, especially under the skin of collarbone. The electrodes are then connected to the pulse generator via the leads. It will analyze the beats, rate, rhythm, and relation between the beats of the upper and lower chambers. When it detects heartbeats that are too fast, too slow, in an irregular way, or problems in the electrical system of the heart, it sends signals to the pulse generator. The pulse generator then sends electrical impulses to the heart and makes the necessary heartbeat correction, and if required, restarts it. The pacemakers are required for heart conditions like arrhythmias, heart block, atrial fibrillation, syncope, sick sinus syndrome, heart failure, and hypertrophic cardiomyopathy. The other things you should know about a pacemaker are: after inserting a pacemaker, you need to give extra care to the arms and shoulders of the side it is in for first 6 weeks, but normal physical activities can be resumed gradually. Electrical devices like some brands of microwaves, smartphones, generators, metal detectors in airports, and medical equipments like MRI can affect how they work. So, while receiving calls, cell phones should be placed on the opposite side of the pacemaker, and keeping it in the breast pocket must be avoided. You should tell the healthcare providers and security about your pacemaker prior to any health checkup or security checkup. The pacemaker must be checked every 3 to 6 months to make sure it's working. During this follow-up, any twitching, dizziness, swelling in the feet or ankle, and fast weight gain must be reported to the doctor. The batteries used in pacemaker should be replaced every 5 to 12 years. So, thanks to all these work of science, our heartbeat is saved, at least from SA node dysfunction. For more information on this topic, check the links in the description box below. And to know more about other contents like this, please subscribe to our channel. Thanks for watching.